message should be that examine those balls.
Yes.
Okay, you are showering, touch them, feel them. All right, you feel something abnormal, go running to the urologist. People who get headache after ejaculation, something called orgasmic headache. People who get sick.
Sick?
Yes, there's something called post-orgasmic illness syndrome.
Okay.
Like you get sick, you go, you
You're
have
scaring
sex. Recently, I've had to admit 2 ladies because of recurrent urinary tract infections, because they're only responsive to those IV medication only. And you have to admit them. It's not medication that you can walk into a hospital, get injected and go. You still need to be monitored. So these are things that we really need to take care of. If your partner is touching them, tell them to touch well and feel it as well. Touch well, feel them as well. I mean, even men help their wives to examine the breast. I mean, the converse should be true. Yes. So even women, help your men to
examine the
testes.
Okay.
That's the message.
Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough information to help you make an informed decision. My name is Dr. Hope. Karibu sana. November is Men's Month, so I have a lovely guest, and I'll let him introduce himself first the way he wants to. So Doc, over to you.
Thanks, Hope. Hi guys. My name is Mararo. I'm a urologist. I've actually come to realize most people don't know who a urologist is. A urologist, number one, is a medical doctor. And number two, a urologist is a surgeon. But he's a surgeon who specializes in urinary system. So the urinary system in women, children. In men, we specialize with the urinary system and the reproductive system in men. Right? So sio daktari wa wanawake na sio daktari wa nguvu za kiume. Ni daktari wa njia ya mikojo.
Oh, perfect.
End of story.
Yeah.
Yes.
Actually, I think most people don't really understand that a urologist can actually be for a woman as well.
Yes.
Yeah, so thank you for pointing that out.
Yes, the only thing is that most of the people we see, probably you can say 85% are men.
Yeah.
But you also see women who come with kidney stones, kidney tumors, bladder tumors, problems with urine. Either they have a lot of frequency, incontinence, all that. And you also see kids who come with bedwetting, undescended testicles, and hypospadia, so many things. Yeah. So it's really a wide field that we see everyone.
Yeah.
Yes.
Okay. Karibu sana.
Asante sana. Nice to be here.
We love to hear that.
Yes.
So to start it off, we normally have a segment called A Journey to Inside Out. So we just want to find out, how are you emotionally or mentally today, right now, as we speak?
Oh, wow. Emotionally, I think I'm in a good space. I'm calm. Been looking forward to doing this. You've been hunting me in these streets. So, yeah, finally we are here.
Yeah.
So, yes.
Okay.
I'm here and I'm glad to be here.
Okay.
Yes.
Me, what emotion? I don't know. Let me say successful, because I found you finally. Let me tell you guys. He has been hard to find, hard to reach, but I'm really happy that at least we're having this conversation now. Now you've already debunked what a urologist is.
Yes.
So for medical jargon, is there something else that you'd like the audience to learn about, or something that people just don't get right that you'd like to clarify?
I think the commonest misused word is prostate.
Oh.
Guys, it's not prostrate.
Oh.
It is prostate. There's no R. Prostrate ni kulala chini.
The one for like West Africans, how they...
It's prostate. Yes. Inaitwa tezi dume.
Inaitwa nini?
Tezi dume.
Tezi dume. Okay.
In Kiswahili.
Hiyo sikujua.
In French, it's called mudhiori.
Is that French?
Yeah.
French ya wapi? The Highlands, Central? Say it again?
Mudhiori.
That is not French.
That is French. You should go to Monaco or Paris. You will hear them say that.
I'll just use that word.
Yeah, just say mudhiori.
And if you don't understand, Doc, I'm coming back to you.
No problem. No wahala.
Sawa, sawa. Let me see. Is there something I want to debunk today? Yes. Digital rectal exam, please. The floor is yours.
So I know one of the commonest reasons why men don't like going to the hospitals and to see a urologist in particular is because they are told a certain doctor is going to put their finger in the behind to examine them. That is called a digital rectal exam. So men usually say, he aende akaniinamishe, aniinamanishe. Hapana, can never be we. So in only select times do we do a digital rectal exam. Especially now, we're actually running away from it. Kitambo guys used to diagnose prostate cancer or prostate enlargement by digital rectal exam.
Okay.
But nowadays, things have improved. We do PSAs, we do MRIs, and then if we need to do a digital rectal exam, when you're doing biopsy, we'll do it. If you come with overt features of advanced cancer of the prostate, then at that time we'll have to do a digital rectal exam.
Yeah.
But it is not something that we do on everyone. It's actually more of a rarity than a frequently used examination tool. Yes.
Okay. I hope the men in the room have had.
Yes.
Please, that should not be the thing that's preventing you from going to hospital.
Absolutely.
Okay. So as we know, it's November. November is Men's Month. And I wanted to at least take some time to talk about men's health. And we just want to have a conversation around prostate cancer, testicular cancer, and just physical health in relation to men in general.
Okay.
So to start it off, maybe let me ask, what are some of the things we are seeing commonly in men these days in relation to their health? And I think you can divide it in terms of like demographics, maybe the younger generation, under 40, over 40.
Okay.
Yeah.
So the kind of the conditions that we normally deal with, again, for the young, they usually come with sexual related health issues. Okay. So when you're seeing men under 40, they all young men, and they will come with erectile dysfunction. A lot of them,
Young men.
It used to be the older people. But now young men are coming a lot. If I see a young man entering my office, I can almost always guess. It's either they're having erectile dysfunction, they have premature ejaculation, or they're having male infertility.
Okay.
Really now we will find other conditions like a kidney stone bringing them, or a renal tumor, kidney tumor. But mainly, it's those three. Okay, they're coming because of a male infertility related issue, erectile dysfunction, premature ejaculation.
And what are like the main causes?
For the young, for erectile dysfunction, mainly it's usually psychological.
Okay.
Performance anxiety, pornography induced erectile dysfunction. That's usually for the erectile dysfunction. For the premature ejaculation, again, mainly psychological, performance anxiety, and masturbation.
Okay.
So those are really the things that cause a lot of that. For premature ejaculation, for the male infertility, it's the antecedent testes and a condition called a varicocele. So those two causes a lot of male infertility. Now, as you go older, for the old men, commonly they come because of prostate related issues. Benign prostate enlargement is very, very common. Actually, one of the commonest surgery that we do is prostate related. They come because of prostate cancer, benign prostate enlargement. They will come because of erectile dysfunction as well. Rarely will you find older men coming because of premature ejaculation. I think because they are so used to the game, they have learned how to manage their expectations.
So used to the game, wow.
They don't promise things they cannot deliver. So they're usually they know they are professors in that field. What else? Then now you have other conditions, like for the smokers, they will come with bladder tumors, and then they will come with other conditions like kidney cancer, urethral strictures, which is narrowing. For children, young boys, mainly it will be either because of undescended testes or a condition called hypospadia or hydrocele. Women, for young girls, usually it's a condition called overactive bladder and bedwetting. For women in general, they come because of urinary related issues. Overactive bladder, they cannot be able to hold urine for long. They have a lot of frequency. There's blood in urine. They have recurrent UTIs, kidney stones, and blood and kidney tumors.
So
Yeah,
what
so
would-
generally, those are the things that bring most people to see a
Yeah.
urologist.
I'm just sitting here, like, I feel like recurrent UTIs explain some of the symptoms you've referred to when you're talking about overactive bladder. But what else would cause an overactive bladder?
Overactive bladder is, see, most people with overactive bladder will come with waking up so many times at night. They cannot be able to hold urine.
Yeah.
And they have that urgency. So you have to rule out all the other causes, like diabetes. Most people with diabetes get overactive bladder. People with dementia, Alzheimer's, back problems, smokers, or even a bladder tumor.
Okay.
Yes.
Okay. Okay. Wow, those are many things.
I know.
I'm like, where do you even start? But let's start with the lowest hanging fruit. Now, you've talked about prostate cancer
Yes.
and benign prostatic hyperplasia.
Yes.
So what are some of the symptoms? Because I know someone doesn't just come and just like, oh, doc, I think I have prostate cancer. Like, how would they present?
So
Yeah.
when we are talking about November, first of all, it's a Men's Health Awareness Month.
Yes.
So there are usually three things that we want to emphasize in this month. Number one is prostate cancer.
Yes.
Number two is testicular cancer,
Yes.
which is one of those things that is really talked about.
Yeah.
You probably realized in all the conditions that I've mentioned, I've probably not mentioned testicular cancer because not as common.
Yeah.
Probably
Have you seen
see-
any in your practice?
Yes, yes.
Okay.
You probably see 2 or 3 in a year.
Okay.
Yes,
Yeah,
but they
that's quite
happen.
few.
It is there. Actually, I think last month I had one.
Okay.
I've had another one earlier this year, so 2. So far I've seen 2. I'm hoping not to see another one
Yeah.
before this year ends.
Yeah.
So prostate cancer, testicular cancer, and men's mental
Health.
awareness.
Yes.
So those are the 3 things that we'd like to put the message across
Yeah.
this month so that men are able to talk about it and get checked about it. So now going back to your question.
Yes.
Prostate cancer. Prostate cancer is common. Let's start from there. It's the commonest cancer that affects men in Kenya today.
Okay.
It is the commonest cause of cancer-related death in men in Kenya today.
Oh, it's more than
Unlike-
GI.
Yes.
Okay.
Unlike for men, specifically for
Specifically
men,
for men,
it's the leading cause of cancer-related death.
Okay.
Unlike in other countries, you'll find guys get diagnosed with prostate cancer, but they don't die because of it.
Yeah,
It's
yeah.
because it's diagnosed earlier than us. That is a problem.
Yeah.
21% of all cancers that affect men is prostate cancer.
21 is high.
It is way high.
Yeah.
Okay, it's way high. And the worst part about it is that in Kenya, 75% of all men that are diagnosed with prostate cancer present at either stage 3 or a stage 4,
Let's talk
which
about
is
that.
advanced stage.
Let's actually talk about that. What do you think influences men's health-seeking behaviors? Because many of them come at almost a point of no return.
Yes.
Yeah.
See, men are always there looking, providing, but then they always forget themselves. That's number one. Number two, men do not like to go to the hospitals. Hospitals are for weaklings. You know, for women and babies, not
Are
us.
you saying we are weak?
Okay, not no, in a man's
No, yeah,
perspective.
yeah.
You see, in a man's perspective, and
Yeah.
then they'll be like, mimi niende nikapange line hapo na mama na watoto.
Yeah.
See, it's the attitude. Yes, that is what makes men come to hospital late.
Yeah.
And then they'll always come, you diagnose them, and they will tell you, hey doc, there's a deal I'm closing. Watch a Eve.
Then I'll be back.
Then we'll schedule that surgery, okay? You will never see them. There's always,
Ay, ay, ay.
you know, there's always a deal they are closing.
Yeah.
They want to panga 1, 2, 3, which never happens.
Yeah.
Yes.
Okay.
So I think men, we are always too busy for everything else apart from ourselves.
Okay.
Yes.
And
which
that's
is a
why we need to
sad
change that.
thing. No, we need to change that.
Yeah.
But I think it is changing, especially with young guys are
Yeah.
coming to hospital more and more. Also because of health education, you know, like a
Yes.
podcast like this, media. So things are working.
Yeah.
Things are working now. Men are coming to hospital now. I mean,
Okay.
if I can tell you an example of things we never used to do a few years ago, we really used to do vasectomies.
Okay, yeah, that's true. That's true.
Yes.
Yeah.
Nowadays,
Yeah.
I'm doing 2 vasectomies every week. That is
What?
a lot.
What? I
Yes.
love to
Yes.
see
So
it.
basically, it means men are taking matters in their own hands,
Yeah.
and they are saying, it's my life. I got this. I gotta do this.
That's true.
So
Yeah.
I think there's a change in that
Okay.
narrative.
Okay. That's good. That's good.
Yeah.
Now back to the symptoms, or like how someone with prostate cancer would present.
Okay. So
Yeah.
the unfortunate bit about prostate cancer is that it never presents early.
Okay.
When
yeah.
you're having symptoms, it's already too late. Okay. And usually the symptoms that will bring someone to the hospital is a low back pain. And by the time they are coming to the urologist because of a low back pain, they have already gone to an orthopedic surgeon, they have gone to a physiotherapist, they have had that physiotherapy session, and the pain is worsening. Then someone somewhere will ask them, have you done a PSA? They do a PSA and it is in thousands. That's when they will be referred to a urologist. So low back pain. Number two that comes with low back pain is usually lower limb weakness, okay. Or heaviness. They feel the legs are too heavy to walk. They feel some numbness on the legs. Others will come with one leg is swollen, okay. Surely it's not even two, it's one.
Yeah.
And because of the fluid accumulation, because there are some nodes that are blocking fluid coming up.
Yeah.
We call that lymphedema. So they come with that. Others will come because of anemia. They have low blood, so they will come with easy fatigability. They cannot walk for long. They are fatigued.
Yeah.
Yes, and some will come coughing because
That's
the
actually
disease.
late
Yes,
stage.
because the disease has already gone to the lungs. So that is late disease. There are others who will come because of kidney failure, because the disease already blocked the ureters, so urine cannot flow to the bladder. So those are late signs.
Yeah.
That's what most men, 75% will come with that. Actually, most men will always come with a low back pain, typically. So don't ignore that low back pain.
Yeah.
It's usually more ominous than you might think.
Okay.
The other symptoms that bring them is blood in urine, blood in semen. Others are diagnosed because they came with some non-specific urinary symptoms.
Yeah.
See, they will come because of symptoms that are not specific to prostate cancer.
Okay.
But then during the workout, during the evaluation, we actually diagnose the prostate cancer.
Yeah.
Because they will come with frequency, they will come with urgency, they will come with waking up at night, they will come with incomplete bladder emptying.
Yeah.
So when you are evaluating them, then you will rule out prostate cancer, and then
Yeah.
you end up diagnosing them with prostate cancer. Yes.
Okay.
Yes.
Okay. And I think for me, especially when I worked in Karatina, and of course I was working with a lot of geriatric patients.
Yes.
And they would always come when it's almost fully obstructed. So now there's absolutely no urine passing. And I think it's that thing where you just wait to the last minute, and then they're just like, "Ay, sasa kuna kitu napita, I must go to hospital." And I always used to wonder, but this can't have started yesterday.
No, it
Like,
doesn't.
I'm sure.
See, the thing is, men don't even talk, okay? Because they will start having that frequency. They will start waking up 2-3 times and they say, si ni ile magonjwa ya wazee. Okay? Then they start taking long in the toilet.
Yeah.
They come and tell you, mi nitakaa hapo dakika 5. See, they're taking longer, but they're like, hii ni ile magonjwa ya wazee. Until they wake up and they cannot pass in the urine.
Yeah.
And now because they're in a lot of pain, they have to go to the hospital. And that already is too late.
Yeah.
Yes.
So now how do we distinguish? Because BPH, benign prostatic hyperplasia, presents in similar ways like prostate cancer, especially the urinary symptoms. So tell us a bit more about that.
So
Yeah.
benign prostate enlargement, you see, as we age, all of us men, our prostate enlarges. Okay. But doesn't mean that it need to be treated just because it has enlarged. Okay. It will only get treated if it becomes symptomatic.
Okay.
Its symptoms are usually more straightforward than prostate cancer.
Yeah.
For benign prostate enlargement, you will have frequency, you're having incomplete emptying, you're waking up at night, you're having hesitating to start peeing. So you'll go to the washroom, you feel the urge, but then it's like it's loading. Should we come out or not? Okay.
Yeah.
And then when it starts coming, it cuts and starts again. That is
Yeah.
called intermittency.
Yeah.
Okay. And then when you finish, you feel you have not completely emptied the bladder, you have to go back. The stream becomes weaker. Instead of going over there,
Yeah.
it's pouring here. You have to pat your legs, otherwise you're going to pee on yourselves. And then they have something called post-void dribbling. Basically means you finished peeing, but then there's still some drops that are dropping on your innerwear.
Yeah.
So those are the symptoms. When it is left for long untreated, they get now urine retention. They start getting recurrent UTIs. They
And
get
it's very
blood.
rare for a man to get a UTI.
Yes.
Yeah.
They get blood in urine, and eventually it will damage the kidneys because
Okay.
the urine will start getting an overflow, a backflow to the kidneys. They get swollen, and then you lose the kidneys.
Okay.
Yes.
So we talked about diagnosis. So what are the treatment measures that we have now for especially prostatic cancer?
For prostate cancer.
Yeah.
So before we even go to treatment, you have to diagnose prostate cancer. So once you
Yeah.
come with those symptoms, usually what we do is that we are going to order a test called a PSA. Again, men fear going to the hospital because they are told PSA, and they think it's digital rectal exam. They think
Yeah.
it's the finger being inserted on their behind. So
Yeah.
we do a blood test. If it is high, then usually we send you for an imaging called an MRI, a multiparametric MRI of the prostate. And the reason we do this is because high PSA is not always indicative
Yeah.
of prostate cancer. So high PSA is not equal to prostate cancer, but it is suggestive, right? So we do an MRI. It will tell us, is there something there? Okay, is there a lesion that is suspicious for prostate cancer? Once we do that, then we are going to biopsy it. We are going to stick a needle, get
Yeah.
a tissue, take it to the laboratory, and then the pathologist will tell us, is it cancer or it is not? If it is confirmed that it is cancer, then we need to stage you. So we'll most likely send you for a test called a PSMA PET scan. And PET scan will tell us, is the disease advanced or not? Once we get a PET scan, then we stage you. And usually we stage prostate cancer into either localized, that means it has not left the prostate.
Yeah.
It is locally advanced, that it has left the prostate, but it's just around.
Yeah.
Or it is metastatic, that it has gone beyond the
Sure.
prostate and the neighboring organs. Probably it has gone to the bones.
Yeah.
So when we are discussing about treatment, then we'll be guided by the stage. We'll be guided by the performance status of the patient. What treatment can he tolerate?
Yeah.
Okay.
Yeah.
And then we'll be guided by the comorbidities. Does he have other conditions? Because you might have conditions that will make it impossible to give you, for example, chemo
Yeah.
or
Yeah.
do surgery. Yes.
Okay.
And now, in terms of treatment, therefore, you will divide this patient into those three. If your disease is localized, then we say we can achieve cure. Okay, either by surgery, by radiotherapy, by brachytherapy. Right. If it is locally advanced, we say we can cure it, but it has a high risk of recurrence. Okay. Again, here you combine. It is combination therapy.
Yeah.
You are doing surgery plus hormonal therapy or radiotherapy plus hormonal therapy.
Okay.
Now, when you go to metastatic disease,
Yeah.
then now it becomes hormonal therapy plus something else.
Yeah.
Chemotherapy, radiotherapy, and basically palliation.
Okay. And palliation is like, it's just mostly symptomatic.
Yeah, it's mostly symptomatic. But the good thing, the thing about prostate cancer, I don't want to say the good thing because no one wants anything good to do with cancer, is that it's a disease that progresses very slow. It's a disease that responds very, very extremely well to treatment. Most people with prostate cancer don't die because of the disease, but they die with it. Okay? You will die probably because of something else, but not because of the cancer.
Okay.
So most people, even who come with stage 4, they'll probably live for another few years before the disease comes back.
Stage 4?
Yes.
Okay.
It responds extremely well to treatment. And number 4 is that most of the treatment regimens or the whole landscape of treatment armamentarium for prostate cancer is available locally and paid for by SHA. I'm not here.
You see, the men are loved.
Yes,
Men are loved.
well, I think it's also because they are up there making policies and all things, so they make sure
Exactly.
they are sorted.
Yeah.
But it responds very well. Treatment is available. It's expensive, but at this point, I would probably tell anyone, if you don't have anything, just go register to SHA. Register with
SHA will cover PET scan.
Yes, it does.
Really?
Everything. PET scan, I think it's 64K in KU. SHA pays everything, every single dime.
Okay, interesting.
Yes.
I feel like I need to have conversations with people who are on the SHA advisory board. Like, we need to understand
Yes,
what is available.
I'm not on the
for
SHA
us.
advisor. I mean,
No, but you see, you interact
granted,
with the patients.
Yes, I interact with these
Yeah.
patients. There are people who will tell you about the wrong about it, the bad about it. But
Yeah.
ask any prostate cancer patient,
Yeah.
they will probably tell you SHA is the best thing that ever happened to them.
Remember the guy who actually went to the SHA offices? He was an elderly man. He had prostate cancer.
Yes.
I think his issue was, okay, that was when they were still sorting it out.
No, the thing is, the oncology package has a cap.
Okay.
So once you exhaust that cap, you
Yeah.
have to wait for it to be renewed.
Okay.
Yes.
Okay. And is it annual? It is. It's like an NHIF,
It
basically,
is,
yeah?
it's annual.
So can you still use it if you've exhausted your cap and the year is not done?
I don't think so.
Oh, okay.
Yes, because I know some guys who have had to go to their pocket to buy some of those injections that we give every 3 months. Yes. But usually they buy the first one. By the time they are getting the next one, it's already been renewed.
Okay. Okay. I think there are two things you've mentioned that I just want to take us back to. So you say that PSA is not indicative of a high PSA is not always indicative of prostate cancer, but it's suggestive.
Yes.
So what are other things that can elevate your PSA?
Oh, good question. So, so we say PSA is not cancer specific, but it is prostate specific. So it is released by the prostate. Okay. So there are many reasons that you'll have PSA being released. Just imagine the prostate as say like a sack of potatoes. Okay. Just imagine potatoes inside a sack, well closed. So that's your prostate. Okay. Now something is happening inside it. Those potatoes are starting to becoming spoiled, right? So you will see some leakage outside of that sac.
Yeah.
So let's say that leakage is the PSA, okay? And now it is going to the bloodstream.
Yeah.
And that is why when you take blood now, you will see it is elevated. It is high. So then you have to figure out what is happening inside this sac.
Yeah.
Okay? It could be just some potatoes are becoming spoiled. Think of that as an infection in the prostate. So we call that prostatitis. So prostatitis will make PSA high, and it actually shoots the PSA very, very high.
Yeah.
Something else is growing, okay, like a tumor, cancer. Okay, so cancer can make the PSA
High.
to go high. You've had sex the previous night, so there was stimulation of that prostate. Okay, so it will still leak some PSA.
Yeah.
So you see that will make PSA go high. You are riding a bicycle, that can also stimulate the prostate. This is going to elevate the PSA, although marginally. Okay, so all these potatoes is so big.
Yeah.
Okay, so that is a very huge prostate, benign prostate enlargement. So that will also make the PSA to leak out of this gunia and then go to the bloodstream. So all those, so it is really my work then to figure out what is making this PSA to go high, and that's where the MRI comes in. So you take an MRI specific to the prostate, and then it will tell you here it is an inflammation, so you're thinking it's more prostatitis. There's something growing here that is suspicious. You are thinking it's prostate cancer, or it's just a big, humongous prostate with a high PSA. Yes.
That's interesting. And I think why I asked that question is because especially now people are getting more into wellness, so they're doing their annual checkups.
Yes.
And there's a preparation beforehand. So you're told you shouldn't have had sex within 72 hours, or is it 48 hours? Maybe I've gotten that number a bit off. Also physical activity. And it's also important questions that your doctor should ask you during the consultation, because I think it can tick off some
the thing
things.
about physical examination, I mean physical activity like riding a bike and sex in the previous 24 hours, they will increase the PSA, but it is the increase is very, very marginal. Yes, it's not like prostatitis, for example.
But now imagine if the patient came running or like walking very fast from wherever they're coming. Will that have like an impact?
No.
It won't?
It won't.
Okay.
Yes.
Okay. Sawa. Now, I know we've talked about prostate cancer a lot.
Yes.
Let's now talk about the younger people. So you said reproductive challenges are what they face. But even now we're seeing more STIs, especially in the younger population. Let's talk about what are some of the common STIs we're seeing, especially in the young men today.
So for young men, they are engaging in some very risky behaviors out there. This guy is only, I think, the only thing they fear is pregnancy.
Yes.
They don't fear anything else apart from impregnating some daughter of the soil. That's their worst fear.
Yeah.
So they will go with all manners of risky behavior. But don't worry, urologists will be here waiting for you. And then you'll come back later because you've got gonorrhea.
Yeah.
And now you cannot sire children because the tubes were blocked. Okay. So the commonest sexually transmitted infection we see is gonorrhea and chlamydia. Yes. So those are the commonest. Rarely do we see syphilis.
Yeah.
And HIV, although there have been reports of an upsurge
Yes.
of HIV
Yes.
cases
Yeah.
reported. And actually, I know 2 young guys in the past, in the probably past 3 months, who were diagnosed with TB in their 20s.
Okay.
You know how uncommon that is unless your
Yeah.
immunity is
Very
compromised.
low.
And guess what compromised the immunity?
HIV.
Yeah.
Yeah.
So guys,
The camera is yours.
guys, this thing is not going anywhere. Just put a condom, right? Protect yourself. These things are real.
Yeah.
Yes.
Yeah. And even now, like over the past couple of years, we've been hearing that there's drug-resistant gonorrhea and
Yes.
chlamydia. Like, that's not a good
Superbugs.
thing.
No, it's not a good thing.
Yeah.
Actually, we are getting a lot of, again, I know that is another big topic, something
Yeah.
called antimicrobial resistance.
Yes.
But it's a big thing. Like, you do catchers and it is resistant to everything. Or it is only sensitive to a very expensive
Medication.
parenteral antibiotic. I've actually had to
So,
admit...
umesema parenteral. You have to explain what
IV.
parenteral.
Okay, IV. A drug that you have to give other than oral.
Yes.
Recently, I've had to admit 2 ladies because of recurrent urinary tract infections, because they're only responsive to those IV medication only. And you have to admit them. It's not medication that you can walk into a hospital, get
Yeah.
injected and go. You still need to be monitored.
Yeah.
So these are things that we really need to take care of. Yes. So I think the other thing that brings, like I mentioned, the other thing that brings young people to the hospital or to see a urologist is mainly sexual related health disorders.
Yeah.
Erectile dysfunctions, premature ejaculation, retrograde ejaculation, people who get headache after ejaculation, something called orgasmic headache, people who get sick.
Sick?
Yes, there's something called post-orgasmic illness syndrome.
Okay.
Like, you get sick, you go, you
You're
have
scaring
sex, you ejaculate, but then you become sick. You get headaches, joint
Yeah.
pains, muscle pains, fever. You actually have to go to the hospital.
Okay.
Yes, so that is called post-orgasmic illness syndrome. It's a thing. It's actually a condition.
Wow. So how do you manage this patient?
So you have to figure out what is causing that,
Of
and
course,
then you manage it accordingly. Yes.
Wow.
There is a lot of something called chronic pelvic pain syndrome. People just tell you they're having pain around here, non-specific pain that is bothering them. And then testicular pain.
Yeah.
And yes, those are some of the common things. Testicular pain and some testicular swellings here and there.
Yeah.
Something called epididymosis.
Yeah.
Yes.
Okay.
Talking of which, other infections of the testicles, like inflammation of the testes and the epididymis, orchitis, epididymitis.
Yeah.
Common things, very, very common things
Question.
that bring,
I have a
that bring
question.
men to the hospital.
Does riding a bike cause enlargement of the testes?
No, it does not.
Okay.
Yes.
A motorbike. Remember, I think we used to have that question as an MCQ in med school. And I don't know, I feel like I wasn't too sure of the answer, but it doesn't.
No, it doesn't.
Okay.
It doesn't.
What about wearing tight boxers?
No, they don't.
They don't.
They don't.
Okay, so let's talk about how to take care of your testes, because I think for November, that's an important conversation to have. Maybe for the younger men also, they can learn how to examine their testes, or what is normal, what's abnormal.
Okay.
Yeah.
Good. So again, in this month, the other thing that we talk about is testicular cancer.
Yes.
So I want to broaden it so
Okay.
that it does not just cover testicular cancer.
Okay.
It covers everything about the testicles.
Yes.
And the things that bring men to the hospital is a mass, okay, or a growth, or somewhere in the scrotum. Let's call it the scrotum, because scrotum is a whole housing.
Yeah.
And then inside the whole housing, it is divided into 2. So they are called hemiscrotums. And in each hemiscrotum, there's a testicle.
Yeah.
And then there's a tube there that stores the sperms. It's called the epididymis. And it continues as a vas that will take the sperms out.
Yeah.
So we'll talk about all that.
Okay.
So the things that will bring people because of scrotal related issues is
Yeah.
they'll have some swelling, which will probably either be some fluid there, something called a hydrocele. There'll be some palpable swelling. So someone will tell me, daktari, kuna kitu nasikia imefura hapa. Okay, it's like a nut inside there. Okay, another nut apart from the nut.
Okay.
So most of the time,
Sorry.
so most of the time it will be it will be something called an epididymal cyst. So an epididymal cyst basically is like a balloon, a small balloon inside the testes. Some usually painless.
Yeah.
Some can grow big so that you feel like you have a third testicle. Others will remain the same.
Yeah.
If it is separate from the testes, it is mainly an epididymal cyst.
Okay.
However, you can also have testicular cancer or a testicular tumor. Usually, this one is attached to the testes, either up or down in either pole of the testes. So you will feel something hard that is continuous with the testes. That now should worry you a lot because it is usually missed again a lot, so that by the time you're coming to the hospital, it's already late again. So what else bring men to the hospital? Or pain.
Yeah.
They will come because of testicular pains, and pain can be because of an infection, epididymitis, or infection of the testes called orchitis. Commonest cause is chlamydia, which is a sexually transmitted infection.
Yeah.
All right. So it's something we always treat, which now can cause chronic orchitis, which will give you that chronic pain in the testes. Other causes of pain will be a varicocele, which is engorged veins there, which causes male infertility. It causes some dull pain. Could be trauma. I've had a young man come because he was hit by a hockey ball. So those are the things that bring men to the hospital because of that. So what should the message should be that examine those balls.
Yes.
Okay. You are showering, touch them, feel them. All right. You feel something abnormal, go running to the urologist. If your partner is touching them, tell them to touch well and feel it as well. Touch well, feel them as well. I mean, even men help their wives to examine the breast. I mean, the converse should be true. Yes. So even women, help your men to
examine the
testes.
Okay.
That's the message.
That's good. That's good. Now, I keep hearing this thing, especially with younger people, blue balls. What exactly is blue balls?
It's basically pain in the testes when you're sexually stimulated, but you're not having sex.
Okay.
Yes. So you're having it's engorgement. Yes.
Okay.
Yes.
So what's the result for that?
Painkiller. Work ice cubes.
Oh, okay.
Yes. Or have sex.
Or have sex. Simply.
Okay, I mean, just have sex. Yes.
So.
Or get ice cubes.
Or get ice cubes.
Yes. Or get an anti-inflammatory.
Okay.
Yes.
Now, as a lady, I keep getting this question, especially for my community. When it comes to yeast infections, can a man have a genital yeast infection?
Yes, they can.
Can they transmit it from them to their partner? No. Okay.
Yeast is not sexually transmitted.
Thank you.
Yes.
That's the question that I keep answering. I just wanted it to come from someone else.
No, it is not.
So how would a man present when they have that yeast infection?
It's a rare thing that will probably be picked once in a while in the urine.
Yeah.
But for them to get yeast infection, they probably have something that is immunocompromising them. Okay, either an infection, diabetes, a cancer, something that is causing immunosuppression.
Okay.
It's a rare thing to find in men. Yes.
Okay.
It's actually, men will not come and you make a diagnosis that they have a yeast infection.
Yeah.
You most likely do a urinalysis and then you find some yeast cells, which are few.
Okay.
Yeah.
Okay. Now let's go to now the rest of the body. I know we focused hapa chini kidogo, but the leading cause of death, especially in men, is not even prostate.
Yes.
Yes. So let's talk about now cardiac lifestyle conditions, because we know NCDs have become more common than communicable diseases, and now they are taking people faster than anything else.
Yes.
So what can we tell the people in terms of their physical health, lifestyle diseases, in terms of what we are seeing from the hospital perspective or from your practice?
So first of all, I'm not the expert in this one.
That's true. Neither am I.
Yes. Probably we should get one who is an expert in this. But what we are getting a lot is we're getting a lot of guys coming with diabetes, hypertension, obesity. And these are the things that pretty much bring men again to see a urologist. Because they'll come, all this will come down to erectile dysfunction.
Yes.
It will bring them to see a specialist. And what is bringing this is all of these are lifestyle diseases. They are
Yeah.
lifestyle conditions. Either because, again, we are too busy to take care of our lives. Okay, we are just driving to work, lift, going back home, take a remote. We don't have time to exercise. We don't watch what we eat.
Yeah.
And we don't even sleep. We don't even get enough
Sleep.
rest.
Yeah.
So those three things: okay, exercise, sleep, and diet.
Diet and
Yes.
mental health as well.
And mental health. I
Yes.
know we are coming to mental health. Yes, and mental health. So those three things. So if there's something anyone need to change today is take care of your life. Number one, make sure you're getting enough sleep. I think it's one of the things that is very, very underrated.
Yes.
Sleep, the potential of sleep. Number two is exercise. And you really do not have to go to the gym and lift weights every day.
Yeah.
Okay?
Yeah.
That 30-minute brisk walk 4 days in a week. I mean, you don't have to win everything. You don't have to win every day. Just win the majority.
Exactly.
Okay?
Yeah.
Just win that majority of the day. And you do not have to just be a little bit consistent. You don't have to be so intensive. It's not about the
That's
intensity.
true. Yeah, it's not about
okay?
intensity.
It's about the consistency. Just be consistent.
We'll put that over here.
Yes, just that. And then watch what you eat.
Yeah.
Okay. I think one of the big reasons why probably I don't think I can survive outside Kenya is food. It's terrible out there.
Really?
It's man.
Is it taste? What makes it terrible?
It's taste. It's fast food
Okay.
mainly. Here I think people take time to cook food. Okay, and we have variety and fresh
Yeah.
food, and that's probably why you find you go to US, the obesity rates are very,
Very
very high.
high,
Again,
yeah.
because of what we eat. So observe what you eat. Reduce that starch, more proteins, more vegetables, more fruit. Take a lot of water.
Yeah.
Yes. So
Okay.
diet, exercise, sleep.
Sleep. Yes.
Bas.
Bas.
And peace of mind.
And of importance.
Of importance.
Peace of mind.
Peace of mind.
Like if your mind is not at peace,
Oh,
hi.
you're
The
going to
rest
gain
is
that
just
weight.
disaster.
The rest cannot work.
Disaster. Yeah.
Yes. Peace of mind.
Yeah.
Yes.
Okay, now let's go to mental health.
Yes. So again, back
Wait.
to November.
Let me ask you first. What does mental health mean to you?
So basically, I think what mental health means to me is being the state of whole being, other than physical diseases.
Okay.
Yes.
Okay.
It does not mean you have cancer. Okay. It's basically the whole being of you, other than having a physical disease.
Okay.
That's mental health.
Okay.
Yes. And I know it's a word that is usually thrown here around.
Yeah.
But I think what most people don't realize is that it affects more men than it affects women.
I disagree, but okay.
No, the thing is, women know how to talk.
Yes.
Okay?
Yeah.
Women will always speak it out.
Yeah.
Men, we don't. We bottle it up.
Yes.
Okay? And when it explodes, there's usually one ending. It is suicide.
Yeah. Okay.
That is a problem. So
Yeah.
you'll have more men for every 5 cases of suicide. 4 are men, 1 is,
One
a,
is a
woman.
woman.
Yes.
Okay.
The reason is because we do not talk.
Yeah.
Yes.
So I would say it affects all of us the same, but we just have different ways of dealing with it.
Okay.
Yes.
Fair enough. Yeah, I agree. That one I totally agree. Women know how to deal with it.
Yeah.
They usually talk. They have people they can talk to. A few days ago we were discussing with some other friends of mine why men don't go for concerts and all those things.
Which concerts?
If you look at most concerts, it's almost always ladies. 3/4 is ladies, and then men.
3/4 is a stretch. Men are outside these days. Like it's nice.
It's a lie. It's a lie.
Okay, fine.
And
Are you outside? Do you go for the concerts?
No.
Okay.
I'm planning to.
Okay. Let's sample the room.
Eh.
There are 2 other men in the room. Do you guys go for the concerts? Okay, so it's 1 in 3. Okay, fine.
one in 3. See?
Maybe you have a point
The ladies
there.
in the room. Do you guys go for concerts?
Yes.
See? 2 out of 2. And the thing is, I think women know how to plan themselves. They know how to panga their life. They know how to plan in advance for that concert. Me, I'll still be here
Closing the deal.
Closing the deal.
Kuna kadil. Let me just
Kuna
close this
kadil,
deal first.
I'm just trying here. Eh?
Yeah.
Again, the French usually say, the French, no kugeria mani, you know. So we'll still be there trying.
Yeah.
Yes, just like the Frenchmen.
You know, I was actually wondering yesterday, when it comes to like different personalities, I'm sure you've heard of type A and type B. I've seen so many women who are type A, but I was thinking, are there men who are type A? Because that leads now the organization and, you know, that pre-planning. Are there
Yes,
men who are type
there
A, or we
are.
call that the like OCD-like symptoms?
Very few.
Yeah.
Very few.
Okay.
Yes.
Okay, that's interesting.
But I'm sure they are, but they are very, very few of them.
Yeah.
Yes.
Those are the ones who now need to teach the rest of us. So I'm not type A, me I'm type B. How to plan and, you know, all those things.
But you know, again, those who have that OCD, you'll never see them in those concerts.
Okay, that's true, yeah, because them they're dealing with other things.
Yes, they don't
Yeah.
want to be where there's a lot of guys people hanging. No,
A lot of disorder.
a lot of disorder. They don't
Yeah.
want that.
Okay. So
Yes.
how do you prioritize your mental health? Let's use you as a sample.
Myself.
Yes.
It's pretty much revolves around work, family, friends. Right. So urology is a very busy field.
Yeah.
So you have to be very intentional about how you balance
Yeah.
work life, how you balance it. So typically and this is something I decided long time ago when I was starting my practice. I don't operate at night. That's number one, unless it's an emergency.
Yeah.
Which in urology there are very few
Yeah.
emergencies.
It's like Otho.
So yes, so rarely will you be called at night because of an emergency. So you will be able to plan your work. So I plan Monday to Friday. I don't work weekends.
Oh, okay.
And I don't do nights.
Wow.
Okay. So that really gives me a lot of time to be around family,
Yeah.
to do my own other non-medical things, to read a book, for example. And then Friday I'll probably have time to hang out with friends and family.
Yeah.
Yes, and that my wife still tells me that what's the word she uses? That I work a lot.
Workaholic.
That I'm a workaholic. Yes. She still says I'm a workaholic. I honestly am trying. Yes, but there's a lot of work.
Yeah.
So you have to be really very, very intentional about the balance between work, life, family, and friends.
And friends.
Yes.
Okay. That's good for balance. So let's go a bit deeper. When you said men don't really talk, how do you navigate tough situations where you have something that you probably should have a conversation with someone, maybe your partner or a professional or like your community? Are you a talker? Do you bottle it in? How do you navigate such situations?
I don't bottle it up. I have every man should have a circle of few friends. Not everyone. You'll probably have 2 or 3 that you can really, really open up to. That this is happening.
Yeah.
How should I approach this? But most of the time, the thing about talking is that you are actually not looking for a solution. You just want someone to listen to you.
This is the second time. Actually, the
That's
third time
all.
this is being said.
Yes. You don't want someone to give you a solution.
Yeah.
Because they will never have a solution for you. The only thing they can do is that they can give you a perspective.
Okay.
They will not give you a solution. But the fact that you have talked it out,
Yeah.
you've put it out there, it lessens the burden
Okay.
in you. So for all the men, get someone you can always talk to. Okay. Get someone. Go for a drive. Okay. Buy him 1 or 2 beers. Talk.
Yes.
Yes.
Okay.
Just talk it out.
Okay. Can I move a bit closer?
Yeah.
Your partner,
Yes.
are they not one of those people that you talk to?
They do, but sometimes they might be the source of the problem.
Okay.
Yes.
Okay.
See?
Stop it. The people but they're enjoying too much. Stop it. Okay.
So there might be
Yes.
things you have, but you really can't talk to them about because they are probably the source of the problem.
Okay.
Yes.
In this particular moment, but maybe when you found someone to listen, do you go back and talk to them?
Yes.
Okay.
Well, you'll figure it out. If it is your
Okay.
partner, then you'll probably both of you need to
talk
seek
it
some
out.
professional help. Okay, because if you start talking, you'll probably end up shouting at each other.
Not
It will be a
necessarily.
shouting contest. So yes, you'll start talking. If
Yeah.
it doesn't work, they are
Okay.
professionals. Okay?
Good.
And nowadays, the beauty about today's age is that these things are there in the digital space. You can actually call someone and they will listen to you. You don't have to go. You don't have to be, it doesn't have to be face to face.
Physical, yeah.
It doesn't have to be physical. Yes. And there are numbers out there, hotlines that you can call and someone will listen to you.
Okay.
Yes.
Okay, that's lovely. Another question. What are some of the coping mechanisms you're seeing outside here that are not healthy? And what are some other healthy ones, apart from some of the ones you've mentioned, that you'd recommend for young men or men today?
I think some of the coping mechanisms that I'm seeing out here is weed.
Okay.
There's a lot of guys who are smoking weed out here, both men and women. Kwanza women, my lord.
Unatuonea, by the way.
Let me tell you, the number of lady friends I have and they tell me they do weed is crazy.
Okay.
And it is, for them, it is, I had a bad day at work. It was busy. They get home, they go to the balcony, and they smoke weed. Guys, it is not healthy. Okay? So that is a very unhealthy coping mechanism.
Yeah.
The other one is going for drinks. Okay? That is a very, very unhealthy coping mechanism.
Yeah.
What is helpful? Go out for a drive. Go for a holiday. Granted, most people will, it's not always affordable, but take a drive. Go, chukua mat.
Change your environment.
Change your environment.
Okay.
Basically, that.
Yeah.
Change your environment. Go hang out with people you've never met. For example, go for a book club. Okay. What else have I seen? There's the book club thing. There's somewhere guys go and leave the phone. Also, cut off social medias and all that, because it's another craze that is actually worsening the mental space,
Yes.
the mental health space.
Yeah.
I know most psychiatrists and psychologists will tell you that. Detach from all those gadgets.
Okay.
Yeah, I think those are helpful coping mechanisms,
Okay.
in my view.
Yeah, I like that for change environment.
Yeah.
It actually does a lot.
It does.
Yeah.
It does a lot.
Okay.
Especially when you feel overwhelmed. It works very well for
Yeah.
people.
Sometimes when you feel overwhelmed.
Yes, sometimes you can work, and by the time Friday is hitting, you are burnt out. So you just want to change environment, go somewhere, chill,
Yeah.
read a book, and
Yeah.
sleep,
Or just walk.
or just walk.
Yeah.
It helps.
Yeah.
Yes.
Now, I know we can't end without talking about infertility. You talked about infertility, and I was like, this is a perfect moment. Is it something that you're seeing is increasing or becoming more common? And first of all, infertility, men and women, who is the biggest causer?
No, the cause is actually the same.
Thank you.
Okay, so you see,
Thank
the
you.
thing
Just
about
need to put that out.
infertility is that kitambo, a while back, it was only, it is, you guys are not able to get children, it's the woman.
Yeah.
Okay?
Yeah.
But now with advancement in science, now we know the causative risk factor is both.
Yeah,
For both men,
50-50.
it is actually 50-50.
Yes.
For both men and women.
Yeah.
You might actually, both of you, be having a reason why you're not able to conceive. And when you're talking about infertility, from where I stand or from the patients I see, let me say this. There are things people take for granted.
Okay.
Like number one, conceiving.
Yes.
Okay, people think you will
It's
just
very
there
easy.
go, you do your things and get pregnant. Conceiving when you want to,
Yeah.
carrying a pregnancy to term, and delivering a healthy baby. Those are things people always take for granted.
Yeah.
Please, you shouldn't.
Yeah.
Okay, there are people out here who are struggling. Number two group of people is the people who don't want to ever get children. Okay, there are ladies and there are men who are like, mimi sitaki kuwai kuwa na mtoto.
It's not my assignment.
Yes, and it is fine.
Yeah.
Respect their decisions.
Yeah.
Okay, and don't keep asking them questions. And then number three, there are those who really want children, and they, for one reason or another, they cannot conceive.
Yeah.
Okay, so I'll talk about the men.
Okay.
Because that's the ones I deal with. The ladies will go to the gynecologist. So if there's one thing that really kills men inside or gives them trouble, is the fact that they know they cannot be able to conceive or to impregnate a lady. Okay, it is stressing mentally, psychologically, even physically, and it is draining even financially. Okay, now one of the commonest causes of men not able to conceive is, see, there are two reasons. Either your testes are not able to produce sperms, or you're able to produce sperms and they're not coming out. Okay, so either the tubes are blocked or the testes are not producing sperms.
Yeah.
And one of the commonest things that causes that is something called a varicocele, which is a reversible cause of male infertility. The other thing that we see is undecided testes. So young man was born, he had undecided testes, and they were not corrected until when it was late.
Yeah.
Okay, so for all mothers and for all parents that are listening, if your child has undecided testes, they should be corrected within 18 months of life, 1.5 years. Beyond that, then sperm production really reduces. It is affected. The other thing that affect this is now these infections, your gonorrheas, your chlamydias, they're going to block those tubes. Your infections like mumps, they're going to reduce the size of the testes and production. Cigarette smoking usually affects the DNA of the sperm. So the quality of the sperm is going to be affected. And then you have now your other congenital anomalies like Klinefelter syndrome.
Yeah.
I think those are two
Genetics, yeah.
Yes, genetics.
Okay.
Yes. Yeah, so usually what do we do? If there's something that is reversible, we do, like varicoceles, we correct it. If it is just cigarette smoking, stop smoking, we give supplements. If it is blocked and the number is
what do the supplements do?
They once you stop smoking, the supplements really help to improve the quality of the sperms.
Okay.
If that fails, then you go to fertility specialist clinics, and then they are going to do IVFs.
Okay.
Yes.
And what are these supplements?
It's supplements that contain things like zinc, arginine, and all those things.
Okay, so they're very specific.
They're very specific.
Okay.
Yes.
Okay, that's interesting. Yeah, so the man can actually also lead you to the IVF clinic, not just the woman.
Yes. Actually, now you will find it's actually the man leading you to the IVF clinic, not the women. And these men, I feel what they need really is a very, very supportive partner, because the partner can just decide, you know what, me, I'll step and get it naturally instead of but I mean, give it up to those who stick up with them. They go for IVF, it works, and they have a happy family. So give up to them.
I feel like there's this interesting book I read last year. It's called The Secret Wives of Baba Segi. It's a Nigerian book, and basically talks about a man who has, I think, 8 wives, and all of them have kids, but none of them are from him. So I think it reaches a point where he actually discovers that he's infertile, but then he's wondering, but all my other wives have children. So like the story just unfolds as how all the wives got their kids and how they got to know this man. And I was just like, this is actually so interesting how like the women decided we will not have this conversation with him.
Yes.
We'll just go and make him look presentable in society.
Yes. Because to break him.
Yes. Yeah. And it did. Like towards the end of the book, it really did break him. Yeah. So it's true. Support is very important.
Yeah, support is very, very important to these young men who are struggling to get children.
To conceive. And I think you've said something so important, that tube blockage. And I feel like I just need to say this for ladies as well. Let me position the mic properly. So STIs, sexually transmitted infections, can actually block your tubes, and that can be a cause of your infertility. So when we say please practice safe sex, it's actually looking out for you in the future, because if you want to conceive, this can be something that can lead to infertility. So please, safe sex is very, very important. Now, Doc, we've talked a lot, and I think I've just identified other topics that next year tutakuja tuongee tena.
All right.
Is there anything that you'd like to share with the audience, maybe as a parting shot?
So for men, I think for this month, if you don't do anything else, if you're 40 years and above, you have a family history of prostate cancer, go do that PSA. If you're 45 years and above, no family history, go do that PSA. Take your health in your hands. See the way you take care of your business. Your health should be your business. Yes.
That's interesting. In fact, Dr. Andrew was supposed to be here. He's an oncologist, but he said, use the oncology you learned in school. That's what we've done. And I think I saw him on, there's this show on NTV where they get, different players to come and have conversations. And he said exactly that. And I think people had been reaching out to ask him, Doc, are there places that are offering, in October, that are offering free screening for breast cancer? And he was like, it's interesting that when it comes to health is when we look for the free things, but when your car needs servicing,
I know,
you will pay. When you need to go to the spa, to go to GWare, you will pay that money. But here you are looking for the free service. And this is not directed to anyone who really can't afford. If you can afford it, pay the best for your health. it honestly, you will reap the rewards in the end. Pay the best for your health, and please prioritize your health. It's very important, and you deserve to prioritize your health. Yeah, so thank you for saying
Well
that.
put.
Yeah.
Yeah.
So now, do you want to be found on social media? Do you want to interact with the audience?
So I
Plug yourself.
yes, just like Hope here, I also teach people about urology.
A lot.
On TikTok,
Yeah.
at the urologist one. At the urologist
We'll
one
put it.
on
We'll
TikTok.
put it down here.
Yes, I think on Instagram it's Muigai Mararo. I think.
Yeah, I think.
Yeah, I think it's
Yeah.
Muigai Mararo.
Okay.
My office
Yes,
is
please.
in Upper Hill. There's a building called 40 Suit. Most people call it Gikoba ya Madaktari because that's where everyone is. So 40
Now,
Suit,
I'm parking.
tuko na
So you,
parking.
please Uber.
So when you come there, ask for Mirazi. There's a parking
you're at
for
Mirazi as
Mirazi,
well?
which is 8th floor, room 9, 809. I'm usually there every Monday and Friday morning. Come early. Usually the clinic gets crazy. It's usually first come, first served.
Okay.
Yes.
Okay, sawa. Thank you so much for joining us and honoring the invite.
Thank you for having me.
And I think we've learned a lot. And yeah, it's a good way to celebrate Men's Month. I think for men, please, the message is clear. Please prioritize your health. Talk to people, talk to your community, your partner. In short, your health is very important. So as we wrap it up, my name is Dr. Hope. You can follow me on my Instagram, Dr. Hope. There'll be many hyphens, so I'll just put it here on Instagram and TikTok. Follow the podcast, A Dose of Health, on YouTube, on Spotify, Amazon, Apple, as well as TikTok and Instagram. So yeah, that's a wrap.